We are predicting more coming in. Again, we're not even at the peak yet. Next week, we'll start that curve is what we're predicting. Staff is getting tired, but we are doing all kinds of creative things.
Scripps Health is making negative pressure rooms as quickly as they can. They just added another overflow tent at their Encinitas hospital, which today was operating its ICU at 183% full.
We're hiring right and left. This week we had 180 new hires. We're hiring EMTs, kind of a novel approach, basically to help to offload the nursing staff.
Scripps officials say staff are volunteering for shifts to relieve pressure in other parts of the hospitals. And while team nursing allows them to do more with less, it doesn't necessarily mean the level of care is going down.
I worry about the care in the sense of people that it used to be in the intensive care unit. Now they're getting care in different areas, medical surgical units or step down units. There's a comfort level that goes with having a patient in the intensive care unit who's on high flow oxygen.
In Escondido, this state-controlled field hospital has started accepting low acuity coronavirus patients. As of Friday, it had 20 staff beds and was holding 13 patients. But hospitals can't just send overflow patients there yet, and officials are having to move patients wherever they can find space.
Transferring internally. So interestingly, now it's busy at Encinitas and Chula Vista. So La Jolla and Green are getting patients from both sides.
Vaccinations for healthcare staff are continuing. Scripps estimates about 70% of its frontline workers have gotten the first dose, and they just started administering second doses this week. But that will take time, and the pandemic is still raging on.
We can get through this. We don't want any more cases that could have been avoided. And the last thing you want to do is be the one responsible for putting somebody in the intensive care unit because you weren't careful.
Matt Hoffman, KPBS News.